So today on Fertility Q&A, I am popping on to answer a question that I hear often, which is, how do I know if I'm ready for IUI or IVF? I'm Dr. Elizabeth Sharavati, and I'm an integrative fertility expert and a global conceivability coach, and this is Fertility Q&A. So here's an opportunity to take a step back and really decide how you want to proceed forward in your fertility care. If IUI, intrauterine insemination, or IVF have been presented to you, or if you've tried them in the past and not had successful experiences and you've taken a break and you're wondering if it's time to go back, then there's a few things that you may want to consider. One, you want to go in expecting and having confidence in your plan and optimizing your chances of success. So IVF has approximately a 30% success rate. Now, when you're working with your clinic, you want to ask them the specific physician who will be in charge of your care, and for the clinic overall, what their statistics are, because that is they do track that. So that will give you an idea about their particular skills. Now, if 70% of the time, though, it's not successful, and by successful, you want to make sure they're talking about a live birth, a healthy baby, not just a pregnancy, because many of the IVF pregnancies will result in a miscarriage, just like natural conceptions can too. So going into your potential IVF cycle, it's really important to feel like you're in your best state of health and well-being possible. Why? Because fertility reflects your health. It's a function of your health and your well-being, physically, mentally, and emotionally. So not only will you enjoy the process of getting pregnant through the fertility clinic more than maybe you have in the past with your experiences there, but you will actually increase your chances of success. I know that the fertility clinics whom we have shared patients with through my clinic, they are always so happy for women to be working with naturopathic medicine, herbal medicine, nutrition, weight management, exercise, stress reduction, and acupuncture, because these things work. Now, it's important that you put together an individualized plan for yourself, but because these are methods that build health back into your case, then they're going to optimize your fertility, which means it's going to be easier to take advantage of the technology available to you through the fertility clinic, like the IVF process. And so I've seen this happen so many times now in my practice that I just want to make sure you know about it, because when women have, for example, gone through 3 or 4 or multiple IVFs and had sort of either painful experiences, devastating ones, a loss, or haven't even conceived at all, it can be very, very stressful. It can be devastating on many levels: financial, relational, social. It affects your career because you're having to take all this time off work. It affects your immune system because you're really stressed and you're all over the place driving and getting to your appointments. And it can affect your self-worth because you're trying so hard, and because society has taught us that we need to try harder to get success, we need to stress to get success, and we need to hustle and muscle and push harder, and finally we will get to our goal. But pregnancy is not something that can be achieved, it can only be received. And how to create the most receptive environment in your body for that embryo, for that baby, is through reestablishing your optimum health. So I hope this helps guide you in terms of whether you're ready for a fertility clinic's procedure. I feel, be congruent, be aligned with that. Let it be a place where you're saying, yes, I feel great, I'm in my best shape ever, I have energy, I feel resilient, and I'm ready to receive this, rather than something that you're going into feeling like you're subjecting yourself to something stressful or you're pressured in by a timeline. The timelines at the clinics are not real. They're artificial. You can ask for more time. You can ask for 3 months. You can delay for 6 months. And that will be a true investment in not only your fertility success, but the health of yourself, your partner, And most importantly, your unborn child, whom you already love, you can give them the best possible start in life by doing the things that optimize your fertility and health starting right now.